Une fois de plus, bienvenue dans cette édition du Morning Call. Beaucoup d'observateurs en parlent déjà.
Many observers have already spoken on the need to take a step forward in the research of this pandemic. A new vaccine experiment against AIDS will be tested from today, and this will be for 4 years in South Africa. It is the framework of the study called HVTN 702, which will target more voluntary 5,400 sexually active people of 18 to 35 years in 15 areas across the country. After more than 30 years of unfruitful efforts following the identification of the virus in 1983, this clinical trial is a hope for the international scientific community, especially for the South Africa of more than 7 million people living with HIV.
Well, just to recall that the last HIV vaccine to show promise was tested in Thailand that started in 2003. South Africans are making history by conducting and participating in this first HIV vaccine efficacy study to build on the results on the Thai trial. The study will be conducted on sexually active men and women who do not have HIV, and their results expected in 2020. The participants will also be randomly assigned to receive either the study vaccines or a placebo, and if any participants become infected with HIV, they will be referred to local medical staff for care and will be counseled on how to reduce their risk of transmitting HIV. But what better way to understand the effectiveness of this South African study than to ask the specialists themselves? We are glad to be joined by Professor Gita Ramje, the Chief Specialist Scientist and Director of the South African Medical Research Council's HIV Prevention Research Unit. Thank you very much, Professor, for joining us today on the Morning Call. Can you please explain what makes the trial of this vaccine special?
Vaccine trial, the concept is same as any other vaccine people receive. So the whole idea of vaccine in this particular case is it's trying to elicit an immune response for it to fight HIV. So having the vaccination produces antibodies or immune fighters in your body to attack the HIV to prevent you acquiring HIV infection. So it's one of the largest clinical trials that is going on in the vaccine field, and one of the largest in the world at this point in time. And more importantly, it's a vaccine that is developed for the HIV virus that is currently circulating in Southern Africa, which is clade C. So the risk would be, for now, it will be looking at, the effects of the prick. You might get a rash, you might get a bit of fever. So we just monitor that after the vaccination.
And Professor, what are the prospects of this vaccine that the African continent should be excited about?
I think we should be excited about this because the vaccine that is tested in this trial is a modification of the vaccine that was tested in Thailand, which for the first time in the history of vaccine research, we saw a 31% effect on HIV prevention. And what we've done now, taken that vaccine that was used in Thailand and modified it for the clade that is circulating in Southern Africa, which is clade C, and Thailand has a clade B and E circulating in Thailand. So we modified it to make it more robust and used for Southern Africa. An earlier study, a small study, showed that it was even better than what we saw in the Thai trial in terms of the immune response generated by this particularly modified vaccine.
A last question. As the trial begins today, what should we expect or what will happen till 2021?
The trial has 5,400 people to be recruited from 15 sites in South Africa. Just to recruit those people, we need about 12 to 18 months to get the whole total people recruited in the trial. Thereafter, people will be vaccinated and followed up to a maximum of 2 years, monitor the safety, the effect of the vaccine. It takes several years to do that. So by 2021, we are hoping all the participants who are in the trial will be followed up for safety and to see whether there is an impact on HIV prevention, and then looked at the data. And if the data shows promise, it has to be presented to the regulatory authorities to ensure that they look at the safety and the efficacy of the vaccine before it can be registered as a product for public health impact.
That was Professor Jita Ramji, the director of the Unit for Prevention of AIDS in Council on Medical Research in South Africa.
Au sein d'un centre de recherche médicale en Afrique du Sud.